There we go. Okay, so I'm here with Dr. Jeans. Am I pronouncing that correctly?
Yes.
Okay, there we go. Perfect. And why don't you go ahead and just quickly introduce yourself, and what sports you played and when you graduated and just those basic things.
Yeah, sure. So I graduated from Stanford in 1991. I played soccer, and then took a couple years to finish my pre-med courses because I changed majors. Well, I had an international relations major, but then decided to go into medicine again. So it took me a while to complete my courses. And then I attended University of Minnesota Medical School. I'm from Minnesota. And then took a year off to raise my first daughter, and then went to University of Colorado for residency. And now I'm working in Billings, Montana. I commute to Montana to work in a small hospital.
So talk to me more about your like international relations major and that
Yeah.
sort of maybe transition. Like, did you always know that you wanted to go into medicine, but then you just were also passionate about international relations? Like, what was that like?
Well, I went to Stanford thinking I was going to be a doctor, but kind of by default. My dad's a doctor, and I didn't necessarily have any other passion other than wanting to be a professional athlete, but that wasn't going to happen because I wasn't that talented. So, um, but I didn't do well in my pre med courses. I did pretty poorly in biochemistry. So then I decided to change my major to international relations, and I really enjoyed that. It was great, great major. I learned a ton. It was fascinating. But then I had an experience. I think summer before my junior year, I worked in a lab doing clinical research, and came to realize that I really did want to become a doctor. I wanted to pursue a career in medicine. So I met with this amazing advisor, and she basically walked me through how I could make that happen. So I finished my international relations degree while finishing some pre-med classes at Stanford. I actually transferred to University of Minnesota for a quarter in a summer so I could do the organic chemistry. I took classes at Foothills College, at Macalester College, and then for the 2 years where I was completing those, I worked doing temp work and worked as a waitress. Yeah.
I have biochem coming up, so so wish me luck on that.
Well, luckily, it doesn't pertain that much to being a doctor because I think I'm a decent doctor, even if I didn't do very well in calculus and biochemistry.
There we
So,
go.
yeah.
I'll keep that in mind. Well, that's really interesting. That you came in wanting to be a doctor and then decided that like the pre-med path wasn't all that it was chalked up to be, um, and then made a pivot and then returned. That's pretty phenomenal.
Yeah, and I think it also speaks to the fact of how hard the courses are at Stanford. I mean, they were a lot easier at University of Minnesota. Not that I would have ever done anything different. I love my education at Stanford, but yeah, to be pre-med there is tough.
Yeah. So with your experience of taking a few years off after your undergrad to finish up your pre-med courses, do you recommend that other people do that? Um, or did you not
Yeah.
really enjoy like how many years you took off to solely pursue like the pre-med courses?
Well, once I changed my mind and decided I wanted to go into medicine, I was pretty determined, and I wasn't really thinking about any other options. I
Yeah.
thought, I'm going to get in and I'm going to keep trying. I can be kind of stubborn that way. I do think it is really helpful to take a year off between medical school and, between college and medical school. It's a lot different back when I was going to medical school, but my oldest daughter just got into she just started at Case Western Reserve.
Hmm.
So she's in her first year there. And she was talking about how medical schools are really actually looking more favorably, in fact, on people who take a gap year, get a little more experience out in the world. Maybe you're working as a scribe or you're doing some clinical research. And plus, it's just takes a lot of stress off that whole application process.
Yeah.
If you can do that, take the MCATs the spring of your senior year, work on your applications that summer, and then apply and do the interviews. I think it'd just be really tough to do that these days while you're in school. It just seems so much more high stress than when I was applying, for sure. And she applied to 18 schools, which she was told was a reasonable number. She had friends who were applying to 30 schools and up, and that's just a lot of work.
Yeah. Yeah, I really it is amazing to watch those who uh take on this endeavor in the middle of also their schoolwork, um, which undoubtedly also includes difficult courses like chemistry. It is really interesting. I relate to what you said about deciding on something and then being really stubborn about it with the courses. This summer, I took all of general chemistry and half of organic chemistry in 9 weeks because I had decided then that I wanted to go to med school, and that was sort of my option. And I said, well, let's do it. And I had so many people telling me, that is a terrible decision. That's not really going to work. And I said, well, like, oh, well, here I go. And it worked out. So yeah, taking courses outside of Stanford is definitely something I also have experience with. And it worked out.
Yeah, and I think kind of as a segue, I think some of those characteristics, personal character traits that get you into med school and make you be an excellent doctor can also later on in life be kind of detrimental. That drive, that competitiveness, that perfectionism. I mean, it took all of that for me to get into Stanford and be a student athlete and be successful in med school and residency. And it's not that I don't want to be a perfectionist as a doctor. I do. I don't want to make any mistakes. But you also would, over the years, I'm trying to come to more of a balance so it doesn't become, too much of a drain on my personal life. And that's something that balance is hard to strike. Yeah.
How do you have any tips on how to do that? Or like what are the things that you try and do to like salvage your own sanity?
Yeah. Well, and I've been thinking about this recently too, because like I said, my daughter is a first year medical student. And I look back on the mistakes that I made. I really made my life about my career, despite being a wife and a mother. And I worked very long hours because I wanted to do things correctly. And it got to the point where I was pretty burnt out and dealt with some depression and anxiety. And I wasn't exercising. I wasn't taking care of myself. For me, exercise is really important, and I think for most athletes, it is, and we want to maintain that. As you get out of school and get later on in your life, that's something that's important for us. For me, not only for staying healthy, but also for my mental health. I did get some counseling later on in life. I wish I had gotten that earlier because anxiety has been something that I've dealt with for a long time. It just got to a certain point where I really had to deal with it. And then just finding mentors maybe earlier. I had some great female mentors, after I'd been in my career for a while. I wish I'd sought, especially, like I said, female physicians out earlier and gotten some guidance from them. But I do think it is, and this goes back to that gap year. I think it's really important to just really have a good lifestyle going into medical school, residency, and becoming a physician. In a balance with your mental health, your physical health, your emotional health, because I'm sure you, as anyone who's going to watch this video, has heard about the amount of burnout that happens with physicians and healthcare providers.
Did you find that your burnout was more substantial in residency and beyond versus in med school?
Definitely.
Yeah.
Definitely. And the problem is you don't even really realize how burnt out you are until you finally get a break from it. And I took that year off after medical school, which was great to spend time with my daughter. But, med school was stressful and challenging, but nothing like the demands of residency.
Hmm.
But realizing also too that I was a resident in a time where there were no work hour restrictions. And I got pregnant during my second year of residency, and that was pretty much frowned upon back then. So it was really challenging. I wasn't expecting accommodations, but I didn't get any support. And to be working 36 hours, and I tried to change my schedule, it didn't work. And, to be working 36 hours when you're 8 months pregnant, and then have to try and just such a challenge to try and breastfeed your kid. And so there was a lot of other stressors going on. And then finished residency, and I went to work for Kaiser as a primary care physician. And it's 2 years of stress while you're building your practice. And I think looking back to some of it was pride too for me. Like, I really want to be autonomous. I don't want to have to ask for help. I don't want to admit that I'm overwhelmed. And I wish that I had been a little more humble and sought more help in terms of counseling and just like, hey, I can't do this. And I think it's also hard for people to say who are successful and who are overachievers to say no. And what other people around you see is like, oh, Dr. Jean's, she likes to do this stuff. She does a good job. We should ask her. So it's kind of a self-fulfilling prophecy, kind of a never-ending circle. That is, you take on more responsibilities, you get offered more responsibilities, and it's hard to set boundaries for yourself. And that's something that I really had to learn. Like, I had to be okay with, I can't do this, I don't have the time, and it's not under my control whether or not somebody is upset about that.
Yeah, that makes sense. We've gotten a bit into your professional life, but I want to circle back
Yeah,
to the beginning. The beginning.
sure.
I get so excited, and I love hearing people's stories. So let's go back to sort of like your med school application process. And maybe it was, I mean, I'm sure everyone's story is different. But you've gotten a little bit into sort of your timeline, but also sort of like, what did you do to prepare for med school applications?
Yeah.
Like what research, what experiences, like in a clinical setting or otherwise, what did that sort of prep look like for you? Because it's difficult as a student athlete to have it all fit in.
Yeah, exactly. And I did have the benefit that I wasn't a varsity athlete anymore at Stanford during part of this time. But some things during the summer, I did clinical research in a lab at University of Minnesota. And then for my international relations degree, I had to have an overseas experience. So I actually walked through graduation, and then I spent 6 months in Ecuador shadowing and assisting a rural healthcare provider. And I did research on indigenous healthcare beliefs.
That's
So
fascinating.
that was a great experience. And also taught me a lot about being independent and adapting. It was a great experience. And then I just had some other various volunteer experiences that I did while I was at Stanford. I taught some health education classes over in East Palo Alto. And then at the time when I was graduating, HIV/AIDS was still a huge issue. So I worked with an HIV organization that provided clean needles and condoms to try and get the AIDS epidemic under control. So I was the mascot. I was Captain Condom, and it was a giant 8 foot tall costume that I wore, and I would walk down Haight Ashbury Street and with other people and hand out clean needles and condoms.
Okay, so you just listed off an entire lifetime of insane experiences that, correct me if I'm wrong, fit into the few years that you had between undergrad and med school.
Yeah, but I mean, it's not like I was going up to San Francisco that often. Those were just some of the variety of the experiences. But I think what's important is finding something that you really enjoy, because you don't want to do volunteer work or an internship or a job that, you're not going to be passionate about. I do think that probably being a scribe would be, although maybe not the most exciting job, it could still be really enjoyable and could help prepare you for medical school. And then some research opportunities if possible. And then it's just, I guess, about finding a balance. You're right, exactly, with your free time. I think med schools look more favorably on somebody who's done kind of rather than a smattering of different volunteer experiences, if they, somebody who's done something consistently. And, it's probably more relevant what my daughter has done recently. And she did research in a lab for a couple years at Stanford, and then she did an internship at the NIH, and
Hmm.
did research in a lab there, while shadowing primary care physician and doing some other volunteer work. But I should also say that I think med schools now are also not looking for people who are just passionate about science and science nerds. They're looking for well-rounded people. So the fact that you're a student athlete at Stanford is really going to, I think, set you apart from other applicants. And if your leadership area or your volunteer area is in something different than medicine, I think that's okay. You just, what you want to do is showcase that and talk about how it's going to prepare you to be a good physician, which is not just about knowing biochemistry and anatomy and pathophysiology. It's also about being able to work with other people and being able to have, good doctor patient relationships. Yeah, they're looking at the humanistic side much more now.
Yeah. And with your daughter and her internship at the NIH, when was that during her timeline of med school
Okay.
education?
So she didn't end up taking a gap year because she took a gap year when we lived overseas in New Zealand
Oh,
for a year. We did that from while she was after she had graduated from high school. And I just wanted a volunteer experience overseas. And so I went to work in a small regional hospital in New Zealand, which was really, really interesting because basically it's a second world country and socialized medicine. Um,
hmm,
so she wanted to go right into medical school. In Colgate, where she attended, they had a program where she could do an internship at the NIH. And so she did that the summer and then the fall of her senior year. And
gotcha.
then she spent that um, year applying. So
Okay.
she'd
And then,
applied her junior year, and that summer while she was at the NIH, she was applying and uh, then doing interviews.
oh, gotcha. And then your experience in Ecuador, did you find that was that through the international relations program, or was that found elsewhere and you built it into your international relations major?
Um, I can't even remember how I did. So we didn't have a program in Santiago down then, it, at that time. So we didn't have anything. So I had to basically create my own overseas experience.
Mm,
So I think I just asked around and I got a contact for a general surgeon in Cuenca in Ecuador who would basically kind of sponsor me, help me, and set me up with a family, and then help connect me with a rural family physician.
huh.
So I guess you know, I've, I've been able to be resourceful about opportunities and seeking out new things and creating things for myself that, and then luckily have mostly turned out pretty good.
Yeah, that's pretty cool. Okay, and now med school. Um, what was that like for you? Was it a shock compared to
Yeah.
undergrad? Did you find yourself in a better position than others because you had the experience of being a student athlete and all the trials that come with that? What did that look like for you?
So I attended medical school at University of Minnesota, it's a good school, but does not necessarily have the academic rigor that I would imagine Stanford Medical School would have. I found it really quite easy after Stanford. The first 2 years were a lot of rote memorization, and you just have to put in the time. Um, and I did pretty well in terms of that. I had enough discipline going in. I don't know if it might be harder for other students from other schools who haven't had to study as much as we have, and who maybe haven't had that intellectual curiosity, so that we've always been seeking out to learn new things. So the first 2 years were pretty easy for me, and very manageable. And in fact, I felt like a lot of my fellow students really put in too much time studying. I mean, there's only so much you can study. You really need to find a balance. And so University of Minnesota offered a work study program where they cut your tuition in half if you work 10 days a week, which was crazy.
Wait, I'm sorry, 10 days a week?
Sorry, 10 hours a week.
I'm like, well, that seems like too many. 10 days a week.
10 hours a week. It's been a little bit of a crazy day in the hospital today.
Seems much more difficult than Stanford 10 days a week. Yeah.
Yeah, so only 10 hours a week, which
Gotcha.
to a lot of people seemed overwhelming, but it was really manageable. And so once again, I worked in a lab. I did some intake at a community health center to evaluate families for WIC, women, infant, and children. And it was a great experience. And believe it or not, I only paid $7,000 a year for my 4 years of medical school.
Wow.
Per year. Yeah.
There we go.
So it also helped being in state, and my dad was a professor at the university, but I don't think you can find that these days unless you get a total free ride. So, and then the third and fourth years of medical school with clinical rotations, they were challenging and hard, but I just thought I had a great time. I had wonderful instructors, and I think once again, like I said, that intellectual curiosity, that always wanting to know more, I think that can often set you apart maybe from your peers, and the attendings and the residents who are supervising you, they can really sense that, and love to teach people who are really show passion about it. And I just tried to be confident and assertive, and did very well. I was student body president and graduated with honors from University of Minnesota. So, it turned out really well. I had a great experience. One of the things that I think was important about University of Minnesota is they have a diversity of hospitals. I found like having a VA, private, university, and a county hospital was really helped in terms of exposure and seeing different types of patients, interacting with different residents.
And so then what did your transition into residency look like? And sort of like the picking of a specialty, and post med school professional medical life.
Yeah. So as I said, I took a year off because I had my first daughter and stayed home with her, which later gave me great appreciation for my husband, who's been a stay-at-home dad all these years. And then I applied to different residencies, and because I was basically applying for a primary care track in internal medicine, and this was before hospitalists were a thing. So a hospitalist being an internal medicine, typically an internal medicine doc who only works in the hospital. So I had my choice of residencies really that I could attend. And, I looked at UCSF, which I love, but decided it was too expensive to live there. Looked at some other places, but they had a more malignant, I would say, culture to them. So I ended up at University of Colorado, and taking that year off, it was a little bit difficult at first. But, I loved it. I had great classmates. At that time, it was a pretty competitive program to get into. So, everyone's very smart and dedicated. It was hard. It was really hard, especially having a little one and then being pregnant, but my husband luckily was very supportive.
Hmm.
Um, and I, I, I can't say that I ever regretted doing it, although there were times where it was super tough. Um, and when I was looking at a specialty, really there were a lot of things that interested me, but knowing that I was going to have a family, I decided to go into primary care. That was also part of the reason I matched in internal medicine. I wanted something that was going to be flexible as a career choice, and I could really have a choice about where we would live.
Hmm.
So that was really important to me. So for me, other specialties were really out, and then going on to a fellowship after internal medicine, it just wasn't something that was going to fit with my lifestyle.
Yeah. And what do you enjoy most about being a hospitalist?
Well, I really love the problem solving about internal medicine. So I first went into primary care at Kaiser because I thought that's what I wanted to do. And then I discovered that was not a good fit for me. I got really burned out. A lot of people really just want you to listen to their problems, and they want a pill and an easy solution. And I found that my patients, um, with my patients, I was having to do a lot of behavioral um, counseling, behavioral change counseling, and a lot of chronic pain management.
Hmm.
um, and it just got to be too much. And I also it was hard for me to compartmentalize my work from my life at home, from my family life, because you're in basket. uh, your inbox keeps growing and growing with results, and it just doesn't stop. And I found like I would be managing that while I was on vacation, at night, on the weekends. um, and so, a friend called me up and she's like, they're looking for hospitalists at this hospital. And I said, you know, yeah, I'll take the job. And that's kind of how some of my career choices have happened. They just kind of changed. And then I had to basically teach myself how to be a hospitalist because I hadn't been in the hospital since residency. And there wasn't any mentorship or supervision provided. Luckily, I'm never afraid to ask questions. And I guess I would encourage people to do that and ask questions and keep asking them. And if somebody won't answer it, then go to somebody else. It's important to be humble and admit that you don't know something. I think the most dangerous doctors are the arrogant ones who don't know what they don't know, or they won't admit it. So I got into, after a year, probably I was down to normal hour days. The first year was like 15-hour days in the hospital, was long, and then really enjoyed it. But there was a change of leadership, of management, and it was just getting really untenable. So then I actually went to work for a bone marrow transplant group. And I worked as a hospitalist for people undergoing autologous, which is bone marrow transplant back to yourself, and allogeneic, which is from other people, and kind of manage their medical issues and work with that team.
What I really like about your medicinal path is just how varied it is. You never did one thing for too long, and you got
Yeah.
to branch out into what seems like every path that you might possibly have wanted to take. Um, and that's what I get really excited about with medicine, and
Yeah.
that's what I sort of envision for my future. Um, but so often I see that physicians sort of, they go in with an idea and they end up doing that thing, and they, the rote, day in, day out, burnout, like you said.
Hmm.
But it seems like you're a way that, I mean, you didn't bring this up, but it also seems like a way that you've been able to combat the burnout of being a physician is just by constantly changing what you're doing so that you have like a new area that you're
Yeah.
passionate about and interested in. Would you say that that's correct?
Yeah, well, I don't know about constantly changing, but I would say that in Kaiser, when I was kind of struggling with really feeling fulfilled as a primary care physician, I then went into administration.
Mm,
And so I did a variety of things. I did hiring for the region. I was head of hypertension control. I ran the regional continuing medical education program, which I really love that. But then what I found, unfortunately, was I was doing all this administrative work, but still had my patients to manage. So now
yeah.
I was doing like more than full time work. Um, but you're right. Some of it has been adaptation to burnout. And part of the reason I moved to the bone marrow transplant group was that the hospital nights were really, they're really tough on me. I'm not really great at night. And I found that I was just, you never slept. And it was just a churn and burn there. It's a hard career now to be a hospitalist. Well, especially now with COVID, but the demands are really high, and getting into my 40s, it was getting tough on me. But then I found that the bone marrow transplant group was not really necessarily a good fit for me because
Mm,
I was at odds with them in terms of their end of life management. Hematologists, oncologists are kind of known for their aggressiveness with treatments. And then I was interested in having an overseas experience with my family. I felt like, we were really disconnected as a family. We were so busy, hardly ever seeing each other. So I talked to my husband about going overseas to New Zealand and convinced him over time, little by little. And then a year later, we moved overseas and spent a year, which initially all of my children were resistant to. They were not happy at all. But then afterwards, everyone says it's been, the probably best year of our life as a family. And I wish we could have spent 2 years there, but it was just too hard with my middle daughter being in high school.
yeah.
And then, so when I came back, um, I went back to the bone marrow transplant group, and I'm like, I can't do this. And that to me was a lesson in a job that had great benefits, great hours, a good team to work with. But to me, it wasn't fulfilling because I was doing much more stuff by protocol. I didn't have autonomy there, which is really important to me as a physician. And then ethically, it didn't feel good to me. Um, so then I looked into temporary jobs, and I ended up at this small hospital in Billings, Montana. And I thought it was going to be a temporary job, but they offered me a full time job and I took it. And, a lot of people have questioned, like, well, how can you do that? Don't you miss your family when you're being up in Billings for 10 days, 7 to 10 days at a time? But what I've found that is my mental health is so much better because I only have to worry about working when I'm here. And then when I'm home, I'm totally present and can spend a lot more time with my one daughter who's still at home and my husband. That I think everyone agrees it's worked out better for us as a family. And of course we talk every night anyway. So
Yeah. Oh, interesting. I really like that idea. That's
yeah,
that seems like a really good setup.
it's not for everyone, but
Yeah.
it's worked for me. And this hospital has a big underserved population. There's a lot of Native Americans, a lot of elderly. We get patients that are here for a prolonged time. They have complex wounds, need for IV antibiotics. They can't be weaned off the breathing machine. So I do get to establish some relationship with them, but I also feel like I'm really helping. To me, it's always been important to work with an underserved population. Like I've really enjoyed working at the county hospital and with the veterans, and now here at this hospital.
Yeah. And you spoke earlier about like the importance of female physician mentors in your life.
Mhm. Yeah.
I was wondering if you just could speak a little bit more about that and sort of like what you've learned from them and why they were so impactful for you.
Yeah. Well, and things have changed somewhat, but I still think that there is a culture that's different for male versus female physicians. I think as a female physician, if you say no or you say I don't have time for something, you can get a reputation as being kind of nasty and rude. versus, I think there's still kind of patriarchal kind of system in medicine where it's easier for men to say that. So sometimes it's hard for, your male colleagues to understand that. And of course, there's the whole work-life balance with having kids and being a wife. So I it was really just not until later when I was working in Kaiser that I found a really good female mentor who helped me kind of walk through different opportunities and how I would deal with the burnout, and then, looking at different opportunities besides primary care. And it was just really helpful to talk to her. And I think there are a lot of female physicians out there that would love to mentor younger female students and help them, as it is it's challenging. It's a demanding job, know what, in any way. And I don't know if this is fair to say. I think sometimes it's harder on women.
Yeah. So sort of on that same note then, with being one of our AIMS physicians, and for this spotlights that undergrads and can sort of see who they can reach out to, what do you think sort of you are able to bring to the table that you can specifically mentor on, that you think that what you like, your expertise and your experience, that you're really able to help undergrads on?
Well, I think, being a student athlete, I can talk to that. And like I said, going back before to how it's important to continue to exercise. I'd gotten away from any competitive sports, but then I found mountain bike racing. And that's something that I started in medical school and continued up until just recently. I've been dealing with some injuries, but that's been fulfilling to me to be part of a team. And it's just, how I'm trying to work that into my spare time. But I think kind of my crooked path to medicine and the very things that I've done in my career kind of give me a different perspective, and hopefully I can, help people to think about different opportunities or how they would pursue their career or different paths. And I also, like I said, my struggles with depression and anxiety have not been insignificant at times. So I can speak to the importance of, good mental health, which, as physicians, we are really, like I said, we're proud. We don't want to admit that we won't need help. And we feel like we have to do it on our own. And that just it's a tremendous burden. And we need to be better about supporting ourselves and seeking help for ourselves.
Yeah. Yeah. Thank you. Those are all, I think, tremendously helpful, what you could give. So thank you. I want to be very, very mindful of your time. And so that's it. In case there's anything else that I missed that you want to make sure that you touched on that I didn't ask, is there anything that you wanted to, that I didn't get a chance to ask?
I guess I would just say, the things that I like most about being a physician are the fact that I get to be an intimate part of somebody's life and I get to help them feel better. It's a tremendous blessing and an honor. And all of my patients that leave the hospital, I usually give them a hug, and I feel like it's a really it's authentic. Like, I have made a huge difference in their life, and I've been able to forge a bond with them. But it is also very, very hard to be a doctor. There are times when I've cried, when I've wanted to scream. And so my advice to high school students when I recently gave a talk was that if you can be anything other than a doctor and be happy, I would do that. But if you absolutely have to be a doctor, then pursue it with all your passion. I don't think you'll be disappointed. It's a wonderful career.
Oh, I'm so glad that you put that in. Thank you. That's an excellent note to end on. Perfect. Okay. Well, let me end this so that